I arrived here in southern Afghanistan during the lockdown. It was a challenge for the organisation, this restriction on movement of people, but also on movement of medical supplies is really problematic.
With so many people being furloughed, companies shutting their doors, people being laid off, the need for help just really skyrocketed.
The people who were hit the most were really the people who were already vulnerable before the pandemic.
They have not enough budget, enough money to compete to buy this high-priced food.
Where we would normally see around 400 people, we would see around 1,000 people coming out and needing food.
Where we are, it's a weak health system, we just can't expect them to cope and to rise to this challenge.
I remember going and working on a shift with a very junior nurse. They were going from seeing all the patients came in and walked home a couple of days later to going to sort of having 3 or 4 deaths a day on their ward. And the impact that had was really quite significant.
If everybody is joining the same efforts, then we can really make a difference for the people who are suffering.
Charities sponsored us 70,000 Hong Kong dollars. So we served over 330 persons.
Donations from organisations like charities means that we can have the supplies and have the equipment that makes it possible for us to provide this kind of care.
The money went directly to supporting our wellbeing zones. One of my colleagues who is a senior staff nurse in intensive care, he said, you know what, the wellbeing zone saved me. He said, I just felt like I couldn't go on.
The way that people have united to make sure that we can still serve the community here has been incredible.
People across the globe looked at what was happening in New York and really gave back. And that includes, everyone at Schroders who gave to us.
We see human is cohesiveness together here.
We received, of course, a lot of beneficiary stories. Like, for example, it was a mom and she was saying, if I can't pay the rent tomorrow, I'll end up on the streets. She was saying that thanks to the emergency aid she received, she had 1 more month of roof over her head to have more time to find other solutions.
People have a very positive reaction when they see our trucks on the road, which is nice. A crossing guard actually flagged down one of our drivers named Derek and, pulled him over and just thanked him for what he's been doing, what City Harvest has been doing.
We're often seeing families leaving the hospital after a number of days in that intensive care unit that otherwise wouldn't have left united like that.
The underprivileged is full of smile. Thank you so much.
It will be extremely impactful on the ground in the places that we work.
It has made a huge impact on staff here at Guy's and St Thomas's. They're doing the caring and someone else is caring for them.